Often when people think of strong pelvic floor muscles, the first thing they think of is Kegels. And I can't tell you how many times I've heard somebody say, do a Kegel at every stoplight and you'll have a strong pelvic floor. It'll keep you from peeing your pants, fixing your prolapse, better orgasms. Woohoo! And while all those things are important and pelvic floor muscles play a role in that, Kegels alone are not the answer. And a side note, for those of you who don't know what Kegels are simply a contraction of the pelvic floor. So the pelvic floor contracts and relaxes. And Dr. Arnold Kegel is the one who, quote unquote, discovered that contracting the pelvic floor muscles and relaxing them help with decreasing leakage. So therefore, Kegel was named. So, pelvic floor muscles are the base of our core and work within a system. And we have to make sure that entire system is strong for our pelvic floor to be strong and engage appropriately. The pelvic floor muscles do not work alone. So, simply doing an isometric contraction of the pelvic floor is not enough to counteract the pressures that we place on it. So we need to have strong abdominals, strong back muscles, strong legs, strong upper body to help our pelvic floor. And this is where weightlifting is key. In today's episode, we're going to dive into the benefits of weightlifting and more specifically, the benefits of heavy weightlifting. For those of us who are assigned females at birth, are vulva owners, this is an area of exercise that we typically have avoided. Some reasons may be that we don't want to look like men. We don't want to bulk up, or I'll get hurt. I'll get injured. Another one is, I'm intimidated. Everyone on that side of the gym, they're grunting. They've got their shirts off. They're checking themselves out in the mirror. They're checking other people out. Last one, at least for me personally, is I might pee my pants. And these are all reasons that I personally have avoided lifting weights up until more recently within, the last 5, 6 years. And so in this discussion today, I'm hoping to give you more insight on why heavy lifting is important and how you can start incorporating this into your life. And if this sparks your interest, we are hosting a course at Bodyworks Fitness in Fortuna, California this Sunday, September 8th at 3 p.m. And I'll have a link in the show notes with more information if you're interested. Much of what is being discussed in today's episode comes from Dr. Stacy Sims' book, Next Level. She is an exercise physiologist and nutrition scientist. And then more resources also come from Dr. Jen Gunter's book titled The Menopause Manifesto, and she is an OB/GYN. So I'll include both of these resources in the show notes. So let's start the conversation today with why it is important for us to lift heavy weights. For vulva owners specifically, our muscle mass decreases with the age starting as early as 30 years old. Hold for a dramatic pause. At the age of 30, there's potential for us to start losing up to 3 to 8% muscle mass per year. That accelerates after we hit the age of 60. So we could potentially be 20% weaker by the time we get to 60, which is wild. And there are a lot of factors that contribute to this muscle loss, and it may not be true for everyone, but this is an average statistic, which needs to be taken seriously. And where research thinks this decline in muscle mass comes from is potentially due to the decline in estrogen, as estrogen helps to regenerate muscle stem cells, which are also called satellite cells. And this is still being researched, but it's found that the number of satellite cells strongly correlates with the changes in estrogen levels. So in short, when our estrogen declines, our muscle mass declines as well. Let's start by defining what heavy weightlifting means. And we're going to start with breaking it down simply into 3 categories of resistance training. So there's light, moderate, and heavy. So light resistance training is lifting light weights, such as anywhere from 1 to 5 pounds for dumbbells, for like bicep curls, or body weight work, such as squats, lunges, push-ups, planks, things like that. And doing them for high repetitions, so 15 to 20 repetitions at a time, doing them anywhere from 3 to 5 sets. This type of training is great for starting, as you can learn the basic movements such as squats, lunges, rows, overhead presses in a really controlled way. The focus in this type of training is really on high volume and conditioning. So some examples are Pilates and Vinyasa yoga. There are also other types of exercises like high intensity interval training, which is a really great form of exercise as well. But we typically call this more of that light resistance because we're not loading the joints with heavy weight. Moderate exercise or moderate resistance training is considered lifting in the 8 to 10 repetition range where the exercise feels relatively hard by that last rep. So here, talking about bicep curls, maybe that's more in that 10-pound, 12-pound range where you're getting up to that 8th rep and maybe you can do 1 to 2 more and it's really fatiguing. And doing that for 3 to 5 sets each, this is that moderate resistance training. And this is where we do start to build some muscle hypertrophy. And it's a great place to start if you are not someone who's done weightlifting before. This is a really good place to start. So finding that weight that feels challenging to get to that 8 to 10 rep. Heavy resistance training is when we are lifting in the lower repetition. So we're doing that 1 to 6 repetition. And that last rep should be really, really challenging to the point where you're not able to complete another rep with good body mechanics. And when I say heavy, this is really variable from person to person. It depends on where you're at in your strength training journey. Heavy lifting could be starting at 5 pounds for one individual, or it could be lifting 200 pounds for another individual. Again, it really depends person to person. Lifting heavy is really good for the bigger compound lifts like squats, deadlifts, chest presses, where it spreads the load across multiple larger muscle groups. And when lifting in this heavier range, this is where we can get the most benefit, which we are going to talk about now. So lifting can start with increasing our metabolic rate. So meaning what helps us burn calories or metabolism. And what heavy lifting does is it wakes up more of our muscle fibers, which requires more energy. And this increases the number of calories being burned at rest. So it's not just cardio that helps us burn calories. Lifting weights also help to burn calories and can help us burn those calories at rest, which is big. It also helps us to improve our posture and stability. So lifting heavy weights stimulates our tendons, which are the parts that attach the muscle to the bone, helps to stimulate our tendons to stabilize our joints. It increases more blood flow to the tendons, which allows us to get more tension and pull, creates the muscle to support the joint versus all of the weight and pressure forcing through the actual joint itself. So for those of us who are hypermobile, like myself, meaning I'm really flexible, my joints just kind of are floppy, this is where lifting heavy can actually help us improve with that stability part. So if you're somebody who's hypermobile, this has been a misnomer or myth that, oh, you shouldn't lift heavy because that's going to mean you're going to dislocate your joints. I've heard that. That is not true. You do probably need to work with somebody to help figure out what the right balance and what the right weight is. But simply because you're hypermobile doesn't mean that you shouldn't do weights. It's actually the opposite. We need to add resistance to help stabilize our tendons, stabilize our joints, get our muscles to start activating and recruiting for what our ligaments are just not helping us out as much. So it helps with improving our posture, improving our stability by lifting weights. So it also helps with improving our bones. This is one that probably more people know and have heard of, but when we lift weights, we're not just working our muscles, we're putting stress on the bones. So when the muscles are pulling on the bones, this signals your body to deposit more minerals into your bones, making them denser and stronger. Studies show that regular resistance training can increase bone density by 1 to 3% per year, which may not sound like a much, but over time, it can definitely make a difference in preventing osteoporosis and reducing the risk of fractures. And as a physical therapist, unfortunately, that is a lot of what I see is our older population, especially more vulva owners that come in because of fractures. And unfortunately, it is one of the more leading reasons for why people lose their independence, ending up having to go to nursing homes and decreases their risk of mortality. So, big factor right there is lifting weights makes our bones stronger. It also helps with blood pressure control. So, while cardio is important for cardiovascular health, and resistance training is just as important. Resistance training increases the vascular compliance, which is the ability for our blood vessels to dilate and constrict more quickly, which helps us with better blood pressure control, blood flow to and from the muscles, and blood flow to and from our skin. It also helps with body composition. So that's typically where we think of the more vanity component, right? But it's not vain to want to have less fat, because less fat in our body means less fat on our organs, less fat on our hearts, less potential for cardiovascular disease. So it helps maintain our body composition. As our estrogen declines as we age, our anabolic stimulus, our muscle building capacity declines, which makes it more easy for fat to be stored, and especially in the abdominal area. So this is where that body composition piece is important. The less fat we have, the better our cardiovascular health is. So we need to lift weight in order to improve that. And then lastly, as far as what we're going to be talking about here today, is our pelvic floor health. So just like everything else that we've talked about, our pelvic floor is composed of muscles, which need resistance to build, just like all of the other muscles in our body. And weightlifting is one way that we can help support and work these muscles. As we go through menopause, like I've said before, our estrogen does decline, which does play a more significant role in the pelvic floor because these muscles have a higher density of estrogen receptors. That does need to be taken into account more. And if you are somebody that does experience bladder leakage or fecal leakage, even with lifting, it's definitely important to have a discussion with your primary care provider, because there may be other medical management necessities as well as weightlifting to help with that incontinence or that leakage. Also, working with a pelvic floor PT is strongly recommended, of course, and there are lots of techniques and positions that we physical therapists can show you, as well as supplemental exercises to support your pelvic floor when working towards lifting heavier weights. And this will be what we are discussing at our upcoming class this Sunday. And I want to share a little bit more about my story. For those of you who haven't listened to prior episodes, I have experienced bladder leakage ever since I was a kid. I would jump on the trampoline, I would pee my pants. I am a dancer, so every time I would leap across the floor, I would have a little bit of leakage. And I was always active. I did Pilates, I did yoga. I was mindful of my body mechanics. And even with all of those low impact exercises and building core strength, I was still peeing my pants. And it wasn't until 5, 6 years ago when I started incorporating weights and doing more of this heavy weightlifting that I started to see a difference in my bladder leakage. Before I started lifting weights, doing any kind of heavier weightlifting, like if I was lifting a 50-pound bag of dog food, I would pee my pants a little bit. Now I can lift 50 pounds and I'm like, oh, no problem. So by adding weight resistance to my program, I have seen a big difference in my ability to not pee my pants. Now, is it 100%? No. There's still lots of things that I need to work on, but I would say I'm honestly 80% better than where I was even 5, 6 years ago. So that is a personal testament to weightlifting. And this is where, again, working with a personal trainer, that is what I did, even though I am a physical therapist and I know, quote, all the things. I still needed somebody else there to help me to know, to give me the cues on what I need to work on to help with that engagement and lift the heavier weights that I needed to. So I highly recommend working with a personal trainer or going to a gym that has a small group class if you're not able to afford having a personal trainer. Those small group classes are really great to get a little bit more one-on-one work with a personal trainer and have that feedback. As we wrap up today's episode, I want to continue emphasizing that weightlifting is an important part of maintaining your quality of life and health and becomes even more important as we age. It isn't just about getting stronger or looking more toned. It is about investing in your long-term health, and it's never too late to start. There have been great studies that have shown people even in their 80s and 90s who are able to build strength when they start a resistance program. There are a lot of wonderful personal trainers out there, classes that focus on strength training, and physical therapists that you can reach out to help build strength in a slow and safe pace to help avoid injury. And as always, consult your primary care provider for any concerns you may have. I hope you found this information helpful, and if so, please share it with a friend who might benefit from this conversation as well. If you want to learn more, join us at Bodyworks Fitness in Fortuna, California this Sunday, September 8th at 3 p.m. And until next time, keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapists, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.